Guys, I started losing my hair 3 years ago, but as you guys can see, as I'm sitting here today, right here, right now, look at my hairline. It's looking good, right? And that was because I was proactive, and I'm going to go over exactly how I was able to retain my hair, but yet also the new protocol I'm going to be using, because last year, unfortunately, I noticed my hairline again starting to recede, so I had to make some changes. But let's first start with the old routine. So here's what helped me the most, and that was being proactive. I wanted to really make sure I focus on being proactive. It is better to retain what you have than try to regain ground on what you have lost. So make sure you're proactive with it. Now, what I did was I started using minoxidil and I started using finasteride. But after about 4 months, I dropped the minoxidil and I just kept on using the finasteride. And guys, it has worked wonders for me. As you guys can see again with my hair, it has done a fantastic job. So finasteride sometimes is all you need, especially when you're proactive. So my first and best advice to you guys is make sure you are proactive, guys. You have to be proactive. Now, let's move on to the new protocol. And the new protocol is because last year I sort of noticing my hair was just starting to thin just slightly more. And now, mind you, I've been using finasteride on a regular basis. I've been on top of it, but my hair was starting to thin, and that's normal, guys. That's normal because, again, I'm aging, and the effectiveness of the finasteride was just starting to wear off a little bit more than it was when I first started using it. But that's where this new protocol comes in, and that is me taking oral minoxidil now. I didn't even know oral minoxidil was a thing until like last year when I started researching again, trying to improve my hair, make sure I'm not losing this valuable thing that we have on our head. Hair loss is a choice now, guys. We don't have to lose our hair. So I started doing my research and I came upon oral minoxidil, and I did some research, and this is shown to be more effective than the topical minoxidil by far, according to the research. I'm going to have to find it because I'm going off the top of my head right now, but I'll make sure to place it in the video for you guys so that you guys can see it, and also the link in the description so that you guys can also find the link and do your own research on it. But oral minoxidil is more effective than topical minoxidil. But again, guys, I'm also not just using oral minoxidil. I'm also using topical minoxidil still. Why am I using topical minoxidil? Because I really want to target these two areas directly. And now the difference is I started using tretinoin as well for these areas. Now, tretinoin is usually used for acne and also anti-aging. So I use tretinoin for those things as well. But tretinoin is proven to make non-responders into responders. I'll also make sure to leave the link of that study in the description so that you guys can find it, do your own research on it. But I'll also be flashing it on the screen when I'm doing this research, right? Or when I'm making this video, I should say. So I'm using tretinoin in that area as well because I'm really trying to directly target these two areas so that the hair grows fuller and thicker. Another thing is I got myself a micro needling pen. Now, in the past, I was using a derma roller. A derma roller is the one of, you go this, whatever. But to be honest with you guys, derma rolling, from what I've seen personally and from what I've researched, is not the most effective way of micro needling. It's really not. Derma rolling also causes scar tissue because of the angle at which it's actually puncturing your skin. It's kind of coming from a sideways angle. And when you microneedle, you want to come from a direct angle, so like a vertical angle almost. And so with a microneedling pen, that's exactly what it does. And that's exactly why I got it. So I'm also using that, and you're able to also change out the needles, which is more sanitary, and you're less likely to get an infection using a microneedling pen rather than a derma roller. So I'm using a microneedling pen now. And again, guys, I've only been doing this for about a month, my new treatment. But to be honest with you guys, I'm starting to see results. The hair is not falling out that often. My hair was falling out constantly. I would comb it, I would brush it. It would just be all over the place, especially when I would take a shower. That's another sign of hair loss, by the way, guys. If you're taking a shower, if you're picking your hair, brushing your hair, whatever it is, and your hair is all over the place, that means you're probably starting to lose your hair. So make sure, again, be proactive with it, right? Now, that's it for this video, guys. You guys can check the links in the description below. I'll also make sure to leave the products that I'm using, probably just a microneedle and pen, because with the oral minoxidil, you have to get a prescription, which you can get on Romans or Hims or Mosley, I think. I got mine from Roman. It was the best price that I could find. I got a 90-day supply, 2.5 milligrams. You're supposed to take 5 milligrams, but I wanted to start with 2.5 because one is cheaper, and if I can get results without having to take 5, I'm going to do that and spend less money, right? But to be honest with you guys, it was just today, this morning, that I decided to increase it to 5 milligrams. So I'm taking 2 pills a day now, starting from today anyway. So make sure you do your own research. That's it for this video, guys. Peace. Take care of yourself and subscribe.